Every year, hundreds of thousands of people become disabled due to illness or injury. And life changes in dramatic ways when we become disabled. We may discontinue many of our family, social, recreational, and occupational activities. We may lose some of our independence, our financial security, our quality of life. In essence, disability robs us of some of the most important experiences of our lives. The program described in this video was designed to help you take back some of what disability has taken from you. If you're interested in participating in this program, one of our providers will set up a series of meetings with you. Your provider will work with you to help you resume many of the activities that once brought your life a sense of meaning and a sense of purpose. Please take a few moments to watch this video, then you and your provider can discuss your participation in the program and how this program can help you make some very positive changes to your life. Aching, pounding, agonizing, excruciating. This is the language of pain, the words we use to describe what we are experiencing. With centuries of technological development behind us, we are still left with only our words and our behavior to describe our pain. There is no instrument that can actually tell us how much pain someone is experiencing. Ironically, while modern technology has not provided us with the means of measuring our pain experience, it certainly has provided us with more and more ways to injure ourselves. We live in a fast-paced society where we are stressed to the limits of our physical and mental tolerance. We stand, we twist, we run, we fall, and we collide. We now understand that certain occupations can place us at risk for injury. Occupations that involve heavy lifting or pulling, such as nursing, mining, lumber, construction, or warehouse work, or fishing, can present situations that may lead to injury. Similarly, occupations that involve long periods of sitting can also lead to problems. Motor vehicle accidents are also a common cause of back and neck injuries. There are also a number of health conditions that can be associated with pain. Health conditions such as chronic musculoskeletal conditions, arthritis, fibromyalgia, diabetes, post-herpetic conditions, intestinal conditions, and some cardiac conditions can cause significant pain even though no injury has been sustained. Pain symptoms can also arise following surgical intervention. The pain we experience can have a profound effect on our lives. We may experience a pain that is so intense that we are unable to work. Our pain may prevent us from engaging in recreational or social activities. We may be unable to meet our daily responsibilities. We may even be unable to care for ourselves. In this video, we hope to help you better understand some of the life situations that might result in pain. This video is intended to help you understand how pain might develop and how best to deal with the limitations that pain might bring. This video also introduces you to the Progressive Goal Attainment Program, or PGAP. PGAP has been developed at the University Center for Research on Pain and Disability to help individuals overcome the obstacles that can lead to disability associated with persistent pain. PGAP was designed for individuals that were experiencing pain due to an injury or health condition. In this video, we hope to familiarize you with the philosophy of PGAP and to explain what this treatment program is all about. We'll interview experts in the fields of pain and disability. These experts can tell us what is currently known about the causes of pain, the treatments available for the management of pain, and more importantly, how to avoid becoming permanently disabled due to pain. When pain symptoms interfere with a person's ability to perform their regular activities of life, it is likely that a medical evaluation will be performed. During the evaluation, the physician may apply pressure to different parts of the injured area. Here, the physician will be gathering information about the degree of pain you are experiencing and will be trying to determine the cause of pain. The physician may also ask you to make a series of different movements, such as bending forward, rotating your torso or your neck, and extending and flexing different muscle groups. The physician will be interested in knowing what movements are associated with pain and what movements may be showing signs of restriction. The physician might also be interested in examining the results of an X-ray or MRI. Since the cause of most pain conditions is unknown, the physician will often be most interested in ensuring that there isn't something really serious going on. To the physician, really serious will mean things like a fracture, a torn ligament or ruptured disc, a tumor or nerve damage. The physician hopes that none of these are the causes of your pain, and luckily these serious conditions are rare. Anti-inflammatory medication and analgesic medication are the two most frequently prescribed medications for pain symptoms. If your pain is the result of inflammation, anti-inflammatory medication will reduce your pain. Analgesics are also prescribed to help with pain relief. We are all familiar with non-steroidal analgesics such as aspirin, acetaminophen, and ibuprofen. These drugs work very well, but long-term use, particularly in high doses, is typically not recommended because of the stress this medication can place on your liver function. Opiates are another frequently prescribed type of analgesic. Individuals with persistent pain conditions may be prescribed medication that contains codeine or morphine in order to provide pain relief. Opiate drugs have their side effects too, the most common being gastrointestinal problems. These drugs can be very helpful in the short term, but they tend to get us into more and more trouble the longer we take them. Many pain conditions recover within the first few months of onset. Other pain conditions persist for months, even years. Some pain conditions will change in severity. At times, the pain might be very intense, and at other times, the pain might be less intense. For those of us who work in the area of injury and rehabilitation, the question we've been asking is, why? Why is it that pain and disability will persist in some individuals and not in others? Really, at this point, we don't know why, but what we do know is that for many individuals, going through life trying to cope with persistent pain will be a very big challenge. In the past, we've tried to treat pain conditions by getting people to rest and remain inactive. We told them to stop working, to rest, and to avoid activities that made the pain worse. But it soon became clear that activity reduction was not the best way to proceed in treating pain conditions. We now know that reducing activity might be the worst thing to do in the treatment of a pain condition. Pain conditions have the best chance of recovery if we remain as active as we possibly can.
Soft tissue injury basically implies an injury to any ligament, muscle, or tendon, whether it's your spine or whether it's your knee. And the healing process is really quite natural, whether it is your shoulder or your spine. For the first couple of days, you have inflammation, and that basically means that the tissues become rather angry, they become swollen, but that settles down over a 2 to 3 day period. That is then called the remodeling phase, and that carries on for perhaps 2 to 3 weeks. Thereafter, you start to get scar tissue, and that's when we know that the individual should be stretching the scar, should be challenging the tissues to try and normalize it. That's when the reconditioning process commences. The modern approach to soft tissue injuries is one that emphasizes early return to the workplace, much like with athletics. We would never put somebody on the sidelines for an extended period of time because they decondition so badly that you just never get them back to that environment, whether it's skating or whether it's working on the assembly line. So the current approach is to take the tissue that is hurt, modify the activity, but keep the tissue keep the tissue challenged, because that's how it heals best. And we've studied that, and we know that, and Hippocrates emphasized that it's vitally important that tissues are not exposed to sustained rest, or certainly not immobilization, because they become sticky like glue, and in fact the rehabilitation becomes very prolonged.
Inexplicable pain is fear-provoking for anyone. And it's for that reason that medical reassurance is very important. It's probably the single most important, cost-effective intervention in treating pain-related disability. It's important to distinguish between being reassuring and being dismissive. To reassure a patient, one has to have that patient's confidence. And that involves a careful history, careful physical examination, and carefully explaining to the patient the nature of the problem. Now, the physician has a role here, obviously, to try to avoid the patient having to leave the workforce. And if necessary to leave the workforce, it should be for a minimum period of time. The physician has to always ask the question, what exactly is it about being at home that will cure this condition? If the answer is they have to be at home, so be it. But if someone with a soft tissue problem is off work, they should be followed on a weekly basis. It's that important. The patient also has responsibilities. One of the major responsibilities is if they're off work to keep frequent contact with their employer and their co-workers, and obviously return to work as soon as possible.
People who work in industries that involve lifting, of course, naturally are the ones that we would see the most of, such as construction. Truck drivers have a high incidence of low back pain. But in general, the group, as a group, the people that seem to have the most problem are in the health profession, such as nursing, because of the lifting and shifting of patients that they do. There's a growing amount of science that says the best way to proceed is to get active as soon as you possibly can. And that would be doing simple things like walking. In recent years, there's been a lot of study done on just that topic, what is the best way to proceed? And it would look like doing simple exercises as soon as you're able is the best thing. Now, when you do that activity, such as walking, it's going to hurt more when you first start, but there's no evidence that pain equals harm. So moving is by far the best way to overcome low back pain, because we know that 90% of back pain is not serious. There's no set rule as to the time that you would know when you're going to go back to work, but as a general rule, when you get up and you get active, you should think about going back to work. Most employers these days are quite anxious to take people back to work and get them involved in that work milieu so that they will soon be able to go back to the type of work they did before. So again, it's when you're up and you're active, you do not have to be pain-free to go back to work.
Who we are, how we feel about ourselves, and our quality of life essentially emerge from our participation in the activities of our lives. I feel a sense of identity through my participation in different life roles, such as my role as a husband, a father, a friend, a member of the community, and through my involvement in my place of work. I feel good about myself when I meet the objectives or the goals that I've set for myself. Disabling health conditions impact on our lives, not only through the suffering that they bring, but through the way that they interfere with our ability to participate in the important activities of our lives. When we discontinue the activities that define who we are, we start to feel an erosion of our sense of identity. We feel a lowering of our self-worth, and we experience a drop in our quality of life. When we develop a disabling health condition, it's natural to want to withdraw from some of the demanding activities of our lives, at least until we feel we've recovered. Unfortunately, for many people with disabling health conditions, full recovery will not be possible. Our medical technology hasn't evolved to the point where we can cure all disabling health conditions. And if our medical or mental health condition is not going to recover fully, we need to figure out ways of getting the most out of our lives despite the symptoms that we continue to experience. If we wait till our symptoms recover completely before resuming the important activities of our lives, we may wait a long time. And during this waiting, we might be watching some of the best years of our lives slip through our fingers. Regardless of whether our disability is due to a chronic medical condition or a mental health condition, the key to rehabilitation success is really the same. It means learning ways to stay as active and as involved as we possibly can in our day-to-day lives. And that might mean resuming activities that we've discontinued. It might mean doing some things differently. It might mean adopting new roles that are more consistent with our abilities and limitations. Our role as rehabilitation professionals is not to cure our client's medical or mental health condition. Our role is to help clients return to being full participants in their lives, even though they may continue to struggle with persistent symptoms of their condition. And it's important to remember that rehabilitation is not a one-time thing. It's an ongoing process. It's a process of setting goals, realistic goals, moving towards these goals, and taking the opportunity to feel good about the gains that we've made. The first step is the most difficult. It's when we decide that now is the time when we will start making changes to our life. But once we see ourselves meeting our goals or our objectives, we start to feel better about ourselves. We start to feel stronger, and we develop greater confidence in our ability to overcome the challenges that our medical or mental health condition has brought to our lives. But to succeed, we need to take the first step.
So what is PGAP and how can it help you? The goal of PGAP is to prevent excessive disability due to pain. PGAP is a program that can help you resume the important activities of your life in spite of the fact that your pain still persists. PGAP is not a program designed to get rid of your pain. It is a program designed to prevent you from being disabled due to your pain. Let's take a look at what typically happens when people become disabled due to their pain. No matter how stressful our jobs are, work plays a very important role in our lives. Work provides us with structure and purpose. It helps define who we are. Work also provides us with social contact. It provides us with independence and financial security. When we go off work, we lose all of this. We lose our structure, purpose, social contact, and financial security. When people are put off work, their daily activities change in a very significant way. It is not unusual for people who have gone off work to become inactive within a very short period of time. When we're off work, we tend to get up later in the day. We engage in fewer and fewer physically demanding activities, and we tend to engage in more and more sedentary type of activities, such as watching television or lying down. So it's not surprising that people tell us that since they've gone off work, they may have experienced weight gain and feel more out of shape. They also tell us that over time, they tend to hear from fewer and fewer of the friends they had at work, and over time, they feel less and less useful. Through participation in PGAP, we hope to help you prevent the decline into chronic disability. We hope to assist you in maintaining a healthy degree of structure and activity in your day-to-day life. We hope that we will be able to help you continue to feel like an active participant in your home, your social world, and your community. Hopefully, when you're ready to return to work, the transition to the workplace will be much easier to make. PGAP does not replace any of the medical treatments that you are currently receiving. PGAP is a program that is intended to complement but not replace the treatments that have been recommended by your physician. Most PGAP interventions last approximately 10 weeks. Your participation in PGAP will involve the following. A main component of your involvement in PGAP will be the development of a walking program. Walking is one of the most important exercises you can engage in to help your body stay healthy. Walking has tremendous beneficial effects on your strength, flexibility, endurance, and overall health. The walking program starts with one scheduled 15-minute walk each day. In the workbook you will be provided with, you will be asked to write down all the different activities you do in a day and how long you do them for. Your PGAP provider will ask you to keep an ongoing record of your daily activities, and he or she will work with you to solve any problems that may arise along the way. Working with your PGAP provider, you will develop an activity schedule that is designed to keep you more active during the day. The activities in your schedule should be things that you were used to doing prior to the onset of your health condition. These may include household chores, running errands, social and recreational activities. Your spouse may be included in these activity planning sessions so that he or she is aware of the program that we are developing with you. Through the course of the treatment program, your PGAP provider will be assisting you in ways to increase your activity involvement. Your PGAP provider will never ask you to engage in any activity that you are not ready for. You will be involved in all aspects of the activity planning. In the final week of the program, you and your PGAP provider will examine how you've progressed. Ideally, you will now be proceeding through your day following a scheduled list of activities, thus keeping you more active, keeping you engaged, and feeling more satisfied with yourself. Many people with disabling health conditions tell us that they wish they could just get their life back. What they're telling us is that they wish they could still have the life they had before the onset of their disabling health condition. That is really what PGAP is all about. It's about helping people get their life back. Even though medical science might not be able to cure your health condition, there still might be things we could do to help you get the most out of your life, even though some of your symptoms still persist. One of the main objectives of PGAP is to help you return to work. This may mean returning to your previous employment, or if that's not possible, preparing you for a different type of employment. By the time you complete the 10-week program, you, your PGAP provider, and your physician will have a clearer picture of the types of activities you were able to perform and the types of activities you were not able to perform. If your condition prevents you from returning to work, involvement in PGAP can still be helpful in contributing to your quality of life. After all, it is through our social, recreational, and community activities that we derive our sense of who we are and what our life is all about. Thank you for taking the time to view this video. We hope that you've learned a bit more about your pain condition and how PGAP can help you resume the activities that have brought a sense of purpose and meaning to your life. If you have any questions about PGAP or would like to discuss further your participation in the program, please ask your PGAP provider.